When you're preparing for surgery, it's completely normal to have questions about general anesthesia. I speak with patients every day if they're a little nervous or if they're just curious about how general anesthesia works, what it feels like, and how safe it really is. Hi, I'm Hish. I'm a consultant anaesthetist. I work closely with the team at Creo Clinic. In this video, I'm going to answer some of the most common questions I hear. My goal is to give you clarity, confidence, and peace of mind before your procedure. What is general anesthesia and how does it work? General anesthesia is a medically controlled state where your body is put into a state of unconsciousness using a combination of different medications. This means you'll be fully asleep, you won't feel anything, and you won't remember the surgery. We use a combination of different intravenous medication to achieve this, and we constantly monitor your body to adjust this in real time. How is general anesthesia administered? Usually it starts with an injection through a cannula in your arm. You'll drift off within seconds. This method is gentle. You won't feel or remember anything while you're asleep. Will I feel anything or be aware during the surgery? No, you will be completely unconscious and carefully monitored throughout the procedure. You won't feel, hear, or remember anything throughout the procedure. We use advanced monitoring and safety protocols to ensure you're continuously monitored and safe throughout the procedure, and to make sure you are asleep and not aware the entire time. So who looks after me while I'm asleep? At Creo Clinic, and in fact across the UK, every patient is cared for by 2 clinicians the entire time. At Creo Clinic, that includes a consultant anaesthetist, such as myself, and an ODP, which is an operating department practitioner who assists me. This 2-to-1 ratio is one of the reasons why anesthesia is incredibly safe in the UK. We're by your side from start to finish. You're never left alone. What are the risks or side effects? Modern general anesthesia is very safe. The most common side effects are mild sore throat from the breathing tube, temporary nausea, chills, grogginess for a short time after waking up. Serious complications are extremely rare, especially in healthy patients undergoing elective procedures like cosmetic surgery. Can I wake up during surgery? This is a common fear, but the answer is no. You'll be under constant monitoring, and we use modern anesthetic agents that act quickly and wear off predictably. And also, we use depth of anesthesia monitoring. So this is a monitor that actually tells us how awake or asleep you are. And it's an adjunct that alongside the clinical experience of your anesthetist and helps us also adjust our anesthetic if you need some more or you need less. Will I feel sick after surgery? Some patients do feel some nausea, but this is very preventable and very easily treatable. At Creo Clinic, we use low-impact, short-acting anesthetics as part of our Apex recovery protocol. This dramatically reduces post-op nausea and speeds up your return to normal very quickly. So how do I manage pain after the anesthetic wears off? Our approach avoids heavy and long-acting painkillers that cause grogginess and a delayed recovery. Instead, we use multimodal pain management. Carefully balanced plan using local anesthetic and paracetamol, along with some other stronger painkillers, so not as intense as morphine and without the side effects of morphine. How long does it take for anesthetic to leave my system? You'll usually feel fully awake within an hour after surgery. Most of the medication leaves your system within a few hours, although you might slightly feel off balance for the rest of the day. And that's why we recommend resting and having someone with you after surgery. So why do I need to fast before surgery? Fasting reduces the risk of food and water entering your lungs while you're anesthetized. And this is definitely one of the most important steps of keeping you safe while you're under anesthesia. You'll need to avoid solid foods such as bread, cereal, or a full meal for at least 6 hours before surgery. Anything with milk like tea or lattes also counts as food. You can usually drink clear fluids for up to 2 hours before surgery. This includes water, black coffee, and tea without milk. Another thing to avoid is chewing gum, mint, or anything similar for 6 hours. The reason for that, it stimulates acid production in the stomach, so it mimics as if you've had a meal. Think of it this way. No food for 6 hours, but small sips of clear liquid are fine until 2 hours before your surgery. Following these instructions is key to a safe and smooth anesthetic. Why should I stop smoking before surgery? Smoking affects your lungs, your circulation, and your body's ability to heal. We strongly recommend stopping smoking well in advance of your surgery, for 6 weeks ideally. This reduces your risk of complications during anesthesia and supports a smoother, faster recovery. Does it matter if I use recreational drugs? Yes, please always tell us if you use any substances, including cannabis, cocaine, or any recreational drugs. These can interact with anesthetic medication and may precipitate different responses from the body. I'm not here to judge, we just want to keep you safe. Can I have many general anesthetics in a short period? In general, having multiple general anesthetics in a short time is safe, especially if you're healthy and each one is done properly. We always take your full medical history into account and adapt your care as required. Does general anesthesia have long-term effects? There is no evidence that general anesthesia causes long-term harm in your brain or your body in healthy individuals. Some older patients, however, may experience some short-term confusion. This usually resolves quickly. Is general anesthesia riskier if I'm older? Age alone does not make anesthesia dangerous. What matters more is your overall health, medications, and any underlying condition. We do a full pre-op assessment to ensure anesthesia is tailored to you, regardless of your age.